All right. Well, let's go ahead and get underway. Thank you so much to everyone who's joined us already, and hopefully we have some other stragglers pop in as we go. Welcome to the September 2023 Arts and Culture Accessibility Cooperative Morning Meetup. My name is Natalie Webb, and I'm the Art and Accessibility Coordinator with MindsEye. I'll be your facilitator today. I'm a 30-year-old white woman with long brown hair. Just a few general reminders as we get underway here. The webinar will be recorded. The recording will be emailed to all registrants in a few days. Along with that, you'll also receive some resources, different links. The video will also be available on MindsEye's YouTube channel. Today, we'll be using the Q&A box as well as the raise your hand function. Please feel free to go ahead and drop your questions in the Q&A as we go, and we will try to get to as many of those as we can at the end. Also, during the designated Q&A portion, you may raise your hand and if you would like to speak, and we will permit you to turn on your microphones. Closed captions are available via Communication Access Real-Time Translation. Just select the CC button on the bottom of your toolbar. We also have ASL interpreters here with us today. Select the interpretation option on your menu, which looks like a little globe, to select that channel. Live audio description is also available. Please use the live voice code 803124. I'll post a QR code for that shortly. Chat to everyone has been disabled due to its interference with screen readers. You may still chat directly with panelists or with me as the host. If you aren't already a member of our Facebook group, you can find us at facebook.com/groups/ACACSTL. And here is that QR code. It is in the center of your screen. You can scan that and it will take you to a page where you will have two options. You can either download the app or you can select join in browser. If you select the browser option, it will autofill a code for you and then just select join live event. If you already have the Live Voice app, you can just enter this code and it will take you to our AD for the event. Again, that code is 803124. We would like to acknowledge that MindsEye is located in Belleville, Illinois, the ancestral lands of many people, including those commonly known as the Quapaw, Miamia, Osage, Kaskaskia, and Kickapoo. We also acknowledge that those who passed near our area during their forced removal, including the Cherokee, Delaware, Sac and Fox, and Shawnee. The process of knowing and acknowledging the ground beneath our feet is a way of honoring and expressing gratitude for the people on this land before us. Currently on screen is a map of the St. Louis area with several overlapping colors, each representing a different nation that lived on this land before us. You can find the interactive map at native-land.ca. And without further ado, I would like to welcome our speaker today, Amy Bartels from MFHA, Missouri, who will be giving us a taste of mental health first aid this morning. Welcome, Amy. We're so glad to have you with us.
Well, thank you so much. I really appreciate that. And I really am genuinely pleased to be here. I'm learning so much about how to use Zoom in some different ways. And so I am hopeful that I'm able to give you some information and remember to do some of those descriptors along the way. So I know it wasn't asked, but I'm going to go ahead and describe myself as well, just like Natalie did. I think that's just fantastic. So I'm a 52-year-old white woman with blonde hair. I am excited as I get to share some information about a program that I think is applicable to a wide variety of audiences with you. So let me share my screen. Oh, and it says that I'm going to stop yours, so I'm hopeful that that's okay. I'm going to go ahead and get my screen up and ready to go to give you a bit of information about mental health first aid. So you know my name, you know a bit about my appearance, but I'd like to give you a little bit about my background. I am currently the project manager for mental health first aid in schools. Our team consists of 5 full-time staff. So we're not a big group, but we are a mighty force. And we are housed at the Missouri Institute of Mental Health with the University of Missouri St. Louis. And so on behalf of Missouri's Department of Mental Health, who is our funder, but they are also a founding partner of Mental Health First Aid USA, our Missouri team helps to manage the program across the state, and we provide that support for over 600 of our instructors, those independent instructors around the state. So why are we having a conversation today about mental health? Well, I want to just reassure you that mental health challenges are really common. In fact, we know that 50% of all mental illnesses begin by age 14, and 75% of those begin to show themselves in the mid-20s. We also know that there's a lot of stigma associated with mental health challenges. People with mental health challenges might be really hesitant to seek help for a variety of reasons. Many times, individuals aren't well informed and they don't know what resources are out there or even how to access that help. In fact, the median delay for people to get treatment once they start to experience symptoms is about 10 years. There's a lot of talk and chatter across the country about our mental health services, not only from our healthcare side, but from our mental health side as well. And we recognize that the national average wait time for services is about 48 days. That being said, is really important for trainings such as mental health first aid to get in the hands of regular everyday folks without that mental health background, because we understand that that can sometimes be that first line of defense or that first line of help for someone that's struggling. I have a little bit of information here for you, a little bit of statistic on my slide. In fact, between the years of 2009 and 2019, the Missouri Institute of Mental Health did some research. They put out a report in 2021 that showed the prevalence rates of the United States suicide rates and Missouri suicide rates. We can see that in 2009, the rates were pretty close, 11.75% in the United States. Missouri was a little higher, 14%. But by 2019, we actually saw the prevalence rates in Missouri start to drop. That's encouraging. But we know that there's still a lot of work to be done because Missouri remains the 15th highest in the nation for those suicide rates. In fact, in Missouri, suicide is the 9th leading cause of death. So our response here in Missouri, by and large, has been to empower and equip individuals with tools to help them understand and respond to those signs of an emerging mental health concern. In fact, mental health first aid is one of those tools, an evidence-based curriculum that becomes that initial help that's offered to a person experiencing a mental health crisis. Many people know how to call 911 or even to administer perhaps CPR when a physical health emergency emerges, but so often they hesitate to start those conversations about mental health and substance use. And so mental health first aid really provides those tools the layperson needs to take that action. In fact, studies show that mental health first aid training actually helps to reduce stigma surrounding mental health challenges and concerns. It improves knowledge and it increases those first aid actions towards someone that's experiencing mental health or substance use challenges. I often refer to this as putting on your noticing glasses. I'm wearing glasses right now, so it kind of, for me, is that good reminder that not only do I have glasses that help me with my physical eyesight, but I like to put on my mental health first aid glasses to notice those around me that might be experiencing a challenge. I also want to recognize that this training is not a substitute for counseling. It's not a substitute for medical care or other professional treatment, but rather it's those initial conversations, it's that initial reaching out that can help provide support to someone that might be struggling. It is proven to be effective in teaching adults how to recognize and respond to those symptoms in another adult. I want to also give you a bit of information here. This slide really is just a graph that shows that people that are experiencing a mental health concern do so on a continuum. All of us, whether we ever understand that we have some type of a mental health challenge, or whether we feel like we really are faring quite well, we operate along a continuum. And that continuum can be from feeling really well to becoming sort of unwell, to being in that really unwell or treatment phase, all the way to recovery or to being in a place of managing symptoms and feeling really well again. So it operates along a continuum. This curriculum, Mental Health First Aid, is really intended to be in that early intervention space. So it's not a prevention program and it's not a postvention program, but rather it's in that middle space where someone is beginning to recognize that they're displaying signs and symptoms of becoming unwell, and another individual can use the skills in mental health first aid to reach out and provide support. The course really teaches risk factors and warning signs of mental health concerns. It gives information on disorders such as depression, anxiety, trauma, psychosis, substance use. But while we give information, we definitely don't teach someone to diagnose. Instead, we offer a 5-step action plan that would help someone who might be developing a mental health challenge or crisis, and also connect that individual to resources, evidence-based, professional, and support, self-help support resources. The information is presented in an interactive environment. So participants practice this action plan through scenarios, discussions, and other activities. And our standard course is available in both English and Spanish. We also have another curriculum that's designed to teach adult participants how to help a young person that might be developing a mental health challenge or crisis. That one is called Youth Mental Health First Aid because it focuses on that youth audience while still delivered to adults that are interacting with youth. So the Mental Health First Aid Action Plan is called ALGE. Our roots of the program come from Australia. And so the mnemonic is also the name of our mental health first aid mascot, which is a koala. And so ALGE, ALGEE, is the action plan. And each step comes with a set of skills that in the curriculum or in the course you have opportunity to learn more about and practice. The ALGE action steps sound like this. A is assess for risk of suicide or harm. L is listen non-judgmentally. G is give reassurance and information. E, encourage appropriate professional help. And the second E is encourage that self-help and other support strategies. So this mnemonic, this ALGE action plan, is really the foundation of the curriculum. This is that tool that you put in your tool belt to help you have those resources to go out and assist someone that might be struggling. So you might be curious about who we're reaching. Mental health first aid is written in a really general language. The course is appropriate for anyone 18 years or older who wants to learn more about mental health. And the majority of courses are taught to a general audience that includes participants from across your community. Specific audiences include, we've got scenarios that are specific to a higher ed audience, to a Spanish audience, to rural adults, to law enforcement and first responders. So again, we've got particular curriculum that might speak to a particular audience, but by and large, most of our courses are taught just to general community. To date, we've trained over 75,000 people here in Missouri and over 3 million nationally. Mental health first aid really strives to make this training accessible to all. We have accessible versions of various portions of the curricula for adult and youth mental health first aid. There are screen reader compatible PDFs and different pieces along the way that help learners be able to absorb and practice these skills. We're not perfect, but there are some things that we've done and are doing nationally. Also want to recognize that we have over 600 instructors in the state of Missouri, and that this course is delivered by individual instructors, either in an in-person format or in a virtual format. Those instructors have differing levels of ability and are able to provide accommodations as needed to their audience. And so we at Mental Health First Aid Missouri can be a really good clearinghouse if there are accessibility questions or accommodation needs from a particular audience. We're happy to help make those connections as we're able as well at the state level. We likely have the ability to hire ASL interpreters to embed in the curriculum to deliver, and each organization might have different specific needs that we're able to address. I also want to recognize several of the virtual pieces that we use when we're delivering the curriculum. That spotlight feature, when we're delivering in the curriculum, you can highlight the speaker. Part of what we do in a virtual environment with mental health first aid is we create breakout rooms. And so we're able to use some of those pieces along with a lot of the features of Zoom to make our curriculum match the needs of our learners. This is a little bit about what the curriculum looks like in terms of time. So this is quite a busy slide, but I'm going to walk through, explain what this looks like. So whether you choose a youth or an adult class to attend, know that based on the needs of your group, you can attend either in person, which is just in a classroom setting in person. There will be a PowerPoint and materials on hand that you work through in the classroom. That's a full day training. So you do those skills applications in that in-person environment, either 6.5 or 7.5 hours of content. At the end, you will become a mental health first aider. You do get a certificate that's good for 3 years saying, yes, I'm a mental health first aider. And it's nice to be able to recognize that in your community, in your workplace, whatever that might be. But we also offer a blended course, and that blended course can be a combination of uh, online learning and in-person learning. And so it looks a couple different ways. If you choose or select to take a blended course of mental health first aid, you'll do some online pre-work. You'll do about 2 hours of that online pre-work uh, connected with our learning platform. You listen to some videos, you work through some scenarios, and then you do your skills application. And as you can imagine, that time frame is reduced because you've done that learning online to 4.5 to 5.5 hours, depending again on whether you're choosing the youth or the adult curriculum. But that skills application piece can be delivered in person or can be delivered like we are here in Zoom in an entirely virtual format. The nice thing about having these different options, thank you to COVID, there are some good things that came out of COVID, is that we quickly developed this online learning platform because it allows individuals to learn in their own space. Sometimes there are situations that make it a lot more accessible for someone to learn these types of skills in an environment, whether it's virtual or in person, but an environment that's most comfortable to them. We do recognize that many of the skills that you learn in mental health first aid can be applied and used in a wide variety of situations. So you might be using your algae skills to provide assistance to someone that you work with. You might use those algae skills to provide assistance to a family member, or as a side benefit, many times people that participate in mental health first aid find that they actually benefit in their own mental health journey from learning the skills taught in mental health first aid. So we do focus a lot on self-care for you as the participant learning these skills. And we recognize, again, that many of these situations and scenarios that we work through in the training come with their own set of situations that might present some challenges for you as the learner. What I'm trying to say is they might feel particularly emotional. And so we want the learning environment to feel really safe, to feel really confidential. That being said, we provide several different learning videos through the curriculum, and we always provide a warning up front of what you're going to see in the video. They're actors in the videos, but they might be portraying a situation of substance misuse. And so we want to give you ample time to understand this is what's coming and recognize that you can opt out of participating in any of those situations and scenarios along the way. Your instructor will provide all of that information to you and work with you to make sure that there's full understanding of the material that you're learning, and then your ability to go out and use those skills to interact with someone in your circle of influence, in your community, sometimes even in your own family. There are a couple of different ways that you can attend a training. So you might want to ask yourself, is my community even ready to talk about mental health first aid? I do want to say that mental health first aid is included in SAMHSA's National Registry of Evidence-Based Programs and Practices. But aside from that, we know that mental health first aid works because every day we hear from people who have used the skills they learned to help a person in need. And one of those quotes of feedback that we got sounds like this. Here's the quote. I appreciate learning more about person-centered language because it demonstrates that the wording we choose makes a difference in terms of stigma and therefore the likelihood of individuals struggling with mental health issues seeking out help. So we get feedback from people all the time who have taken the course and indicate, yes, it does make a difference. I have a link up on the slide of ways that you can find the course. I'm also going to drop that link right now into the chat to Natalie. And Natalie, I'll ask that you share that out in whatever format on this webinar that makes the most sense. I also want to talk to you just a little bit here on the next slide about some of the costs that are involved in hosting or participating in mental health first aid. While we at Missouri Mental Health First Aid offer several no-cost courses each month in that virtual environment, I do want to recognize that there is a cost associated with taking and providing this course. So each participant that takes the course needs to have a participant manual. That manual has a cost of $18.95 up to $23.95. So we kind of generally say it's about $20 to have to partake in having that manual for the course. It depends whether you're taking an in-person or a virtual format. There are some supplies involved with this. If you are hosting the course, you're going to need things like, if you're in person, you're going to need flip charts and markers and a way to share those slides with your participants. And so we roundabout say that the value of this training is about $170 per new first year. You can also become an instructor. You can become an instructor if you say, I love this material so much, I want to become an instructor. And the cost of becoming an instructor is about $1,800. You go through a 3-day instructor training, and then you're certified to go and deliver this mental health first aid training to your community. Is a really exciting opportunity because in Missouri, again, like I said, we have over 600 instructors, and so we would love to provide more information for you if you're interested in becoming an instructor. I have a QR code up on my slide, but again, that's just a link to our website. I have provided that there in the chat, and I see that Natalie shared that out with everyone. But that QR code just gets you to our website. Again, on our website, we host open public courses that are no cost. So the Department of Mental Health is sponsoring those. You can sign up as an individual to attend one of those courses, or like I mentioned on the previous slide, you can learn more about hosting a course for your organization, and we would love to work with you to do that. We've got a couple of other things I'm going to share on this last slide. We have Facebook presence. We can talk to you about hosting a course, bringing a course to your organization. You can find information on our website to sign up to receive our monthly newsletter. We would encourage you to take a course and then to tell others about the course. And we would be happy, again, like I said, we have a team of 5, so we're small but mighty, that help to manage and administer this program around the state. And we would love to have conversation with you about what that looks like to bring the training to your organization, or again, to have those conversations about becoming an instructor. I really thank you for inviting me today to share more about mental health first aid. Again, my name is Amy Bartels. I'm part of the team here at Missouri, part of or one of the program managers that provides a specific lens. My title is Mental Health First Aid in Schools, but we have several other members of our team that work on mental health first aid for our larger community in Missouri, and we're happy to answer any questions. Please reach out to us. Thank you again for giving me this opportunity.
And thank you so much, Amy. Go ahead and share my screen with you all again. We have reached the Q&A portion of our session. So if anyone would like to drop some questions or comments, we also welcome discussion, just general discussion as well. I don't see any in the chat just yet. So I'll go ahead and kick us off. This is the question I like to ask all of our presenters. What's the number one thing that you would like people to take away from this session? And also if you would, from your mental health first aid courses, the in-depth courses, Amy?
Absolutely. Thank you for asking. That's a great question. My biggest takeaway is we would love to see the entire state of Missouri trained in mental health first aid. One of the things about this curriculum, and I hope you can hear the passion that I have for this, is it's a really non-threatening way. The training is a really non-threatening way to just begin those hard conversations. Sometimes it's just a matter of being a good listener, that L in algae, that listening non-judgmentally. And so I guess my takeaway is, if you're curious at all, lean in and take a class. I'd love to have you.
Excellent. And what are some of the biggest differences, would you say? I know we have people on this call that have youth programming, as well as obviously just the general mental health first aid for adults is great for everyone, in our lives, whether personal lives or work lives. So what are the biggest differences between those two programs, would you say?
Absolutely. The biggest difference, well, so first and foremost, they both utilize the algae action plan. The youth curriculum focuses more on typical adolescent development, and then what are warning signs and symptoms, because we know that adolescence is a time of so many changes. And so often those warning signs can either be overlooked or sometimes exacerbated into a big problem. And so the real main difference between the two curriculum is really kind of looking at what does it typically look like to be a young person? What are some of the things that they go through? And then how can I determine when I need to reach out and when something is a concern? But again, a lot of similarities between the programs because they both use algae as the base.
Absolutely. And we do have one question here. Is
Yes.
there a comparable program in Illinois?
There absolutely is. And actually, one of our team members, Isaac Sandage, which he's probably who you all will be working with, unless you are specifically school-based, and then you'll work with me. But he's on our Missouri team, but he actually lives in Illinois and helps to manage the program in Illinois. So yes, and by comparable, I mean, yes, there's the exact same program. So this is a national program. It's actually an international program. But yes, you can find mental health first aid in Illinois as well.
Excellent. So any of our Illinois folks with us today, you
Yeah.
can still reach out. Um, can you dig in a little more to the algae? What does that look like? Can you maybe give some of those examples or just a few that you might share in an in-depth session?
Yeah, absolutely. So a couple of the things that we do, we really set so the curriculum, it's obviously a prescribed curriculum, right? We don't just kind of wing it and make it up, but it really goes through a strategy. So we introduce and talk about what is mental health, what are mental health concerns, what would a mental health challenge look like, and then we introduce algae, right? The assess for risk of suicide or harm, listen non-judgmentally, give reassurance and information, encourage appropriate professional help, and then encourage self-help and other support strategies. Wow, that's the action plan. But the way that we work you through the action plan and make sure that this training kind of is making sense to you is we go from early signs and symptoms, worsening signs and symptoms, to crisis. So we really walk you through, and you have opportunities each time that we kind of introduce a new segment. Okay, we're going to talk about those early signs and symptoms. What might that look like? Maybe it's someone not showing up to a planned event. Maybe it's someone looking a little more disheveled, right? Maybe it's someone starting to say some negative things about themselves. And you might go, okay, well, those are early. I don't think the person is in crisis, but I'm going to reach out and just say, hey, are you doing okay? How are things? And we give real practical examples and instruction, and then allow you through the use of scenarios to practice. So you'll have a scenario, and maybe you have a scenario with a person, right? These are made up scenarios. A person named Mary, and Mary is starting to struggle. And then you, as the learner in the mental health first aid course, get the opportunity to work with a small group to say, well, what would we say to Mary? How would we help Mary? And then you get another scenario, because then we talk about, well, what do worsening signs and symptoms look like? You know, it might be that, okay, they missed an important deadline at work. They missed a couple of meetings. I've tried reaching out on the phone and they're not answering my phone calls, or, whatever. We give some examples of what those worsening signs and symptoms might look like. And then you again get to revisit Mary and practice working through a scenario with your small group. And then we move into crisis. And in the crisis segment, you get some opportunities, what we call a real skill building piece of the curriculum. You get an opportunity in a real safe environment to practice asking those questions, even questions about suicide. So we practice as a group asking or saying out loud, and so we can hear our own voice saying it. Are you thinking about suicide? And then we get to really process and debrief what that feels like. How does that feel to ask those questions? And then you practice that in that scenario. You go back again, then to Mary. Whatever the situation isn't always suicide. It may be a worsening of substance use or substance misuse, or it might be something else. It might be experiencing psychosis. But we get some practicing in with a real crisis situation. How would I use those steps of algae? How would I provide some reassurance and information? How would I listen non-judgmentally? How would I perhaps connect Mary to some appropriate professional help? And so we work through all of those pieces in the span of the training and give you opportunities, again, as you choose to participate and interact with some of these situations. Again, recognizing that we kind of create this cocoon of this safe learning environment. There are no dumb questions, and there also is no time along in the training where you are absolutely required to participate. You are also not put on the spot to disclose any of your own mental health concerns. It's really an outward focus. How would I help someone else? I hope that answers that question, Natalie.
It absolutely does. Thank you so
Mhm.
much.
You bet.
Just and in a we only have a couple more minutes left
Sure.
before I'll start our closing section, but I did want to ask, and what are some of your best tips about talking about these things if this situation comes up? Like, just very briefly, what can people kind of say or like, do now as some actionable tips as we kind of leave our session here.
Yeah, I love that. We focus a lot on using those I messages, right? I noticed that you haven't been at um, our Fiber Arts Club lately. I'm missing you. I recognized that you looked really sad the other day. Do you want to talk about it? Using those I messages, really wanting to share that you care about someone. And I think sometimes it can be we're really conditioned, especially in our country as Americans, that we don't get involved with someone else's business. This isn't a prying type of situation. This isn't a training where we're saying, okay, well, we want you to find out all the details. It's rather having that empathy and compassion for someone else, reaching out, checking in, just even saying, how are you doing? And then when they go, fine, you go, no, really, how are you? Right. So sometimes it's even giving that second check-in and ask. Um, and it's just creating that culture of kindness. We recognize and see someone else and reach out to provide that assistance. We are not, again, we're not diagnosing. And if you notice that first E in algae, it's encourage appropriate professional help. In the training, we're not diagnosing and we're not referring. So there is no R in algae. We're not referring anyone to go see someone. In fact, it's really just saying, I know that there are a world of professionals out there that could help. Have you thought about, or, whatever that might look like. And it's just that encouragement.
Absolutely. That's wonderful. Okay, well, if there are no more questions, get them in quick if you have them. All right. I don't see any, so I'll go ahead and move us along. Special thanks, of course, to today's speaker, Amy. We're so glad to have you. I can't think of a better way to recognize National Suicide Prevention Month than to have you guys here with us today. Such an important topic, certainly one that's very close to my heart. And as we feel these lingering effects from the pandemic that I'm sure we'll be feeling for a while. Yeah, this is just such a great session. So thank you. Also, thank you, of course, to our wonderful access providers, our ASL interpreters from Deaf Inc., Tyler and Hannah, our CART interpreter from Here Inc., LaDonna, and our audio describer from MindsEye, April. We're always so glad to have you all with us. We appreciate your work. We'd also like to acknowledge our sponsors that make these forums possible: Ameren, Illinois, Lighthouse for the Blind St. Louis, AEG CFO Services. Additionally, MindsEye is proud to be a United Way of Greater St. Louis safety net partner. We've kept these meetups free, but we do incur costs. We're looking for sponsors to help pay for our speaker honorariums, ASL interpretation, the live captioning, etc. If you would like to learn more about becoming a sponsor, you can contact me, Natalie, for more information, and we will also include that info in the follow-up email. And my email is just before we leave, inweb@mindseyeradio.org if you would like to reach out about becoming a sponsor or anything else. Last but not least, thank you all for joining us. We appreciate everyone who attends these sessions. We're grateful to have you here. You will receive an email in the next couple of days with the recording of this presentation, and a list of links and resources. There is a survey attached to this Zoom webinar. It should pop up in your browser as we close out here. If you would take a minute to fill that out, it's only 5 questions. It really helps guide us in our work. We appreciate any feedback you're willing to give. Thank you all so much, and we hope to see you at our next ACAC session. Have a great day, everyone.